this morning we talked a little bit about patient compliance and counsel to our patients. What do you do when your patients maybe don't want to follow exactly your advice on a topic?
Yeah, so a lot of what we talked about this morning, I love hearing the thoughts and the discussion about not being a dictator in patients' lives, about being a guide and listening to them and meeting them where they are and helping and really truly understanding their perspective. And I told the story of when I was racing motocross as a 17-year-old.
That was a great story.
And I had broken my hand, and I had some pins sticking out of my hand. And my surgeon knew that I needed to race one last race as part of this championship. And I would lose the championship if I didn't race the race. Mm-hmm. And my surgeon was very wise, I believe, and casted my hand rather than just doing a soft cast so I could race. And he didn't.
Knew you. He knew what you were going to do.
Yeah, he didn't. He just knew what I was going to do. He didn't communicate that and say, hey, I'm going to cast your hand so you could race. I think he just overheard me and knew my goals and knew what I wanted to do and knew I was going to do it regardless of what he was going to say. So he figured out a way in which I could still do that. He modified the recommendations for me so I could still do what I needed to do.
Going through that experience, how do you think that's helped you as a physical therapist in your own practice, treating your own patients?
I think what's helped me the most is to see through the eyes of a patient, to choose to put on a different glasses, a different lens, mm-hmm. and to really listen and mm-hmm. talk about what are your goals? What are you hoping to accomplish? What are your expectations? Yeah. As we truly understand the expectations of the patient, it helps us be able to frame the plan with them. And it's helped me create plans for patients that I never would have anticipated. Yeah. But it's this customized plan that helps them really flourish. And I act more as a guide than a dictator. Mm-hmm. Where, the dictator would be like, you follow these guidelines, and you will get X, Y, and Z. You don't follow these guidelines, you won't get those things, right?
You can't be my patient if you don't listen to me.
Yeah,
right?
But sometimes modifying those recommendations is the best thing for the patient.
Yeah, I agree. I think really just counseling together and giving your recommendations, but also kind of seeing where they're coming from, and helping them achieve their goals, and trying to do it as safely as possible. I think that's awesome. I really like
and some
that.
Patients, they actually can help problem solve with you, mm-hmm. and they can actually help come to a solution on what's best for them. So a lot of times I like to ask questions and really dig at what do you think what the recommendations are. Mm-hmm. How do you feel like you're going to be with complying with those? How do you feel like you're going to be with following those?
Good question.
And sometimes they'll say that's impossible. Okay, what would be possible?
Right.
And asking good questions to mm-hmm. help really problem solve with the patient has been something that I've learned from other mentors as well.
Mm-hmm.